If you wake up every morning feeling older than you should, if your lower back feels locked, your neck feels stiff, your hips ache, or it takes several painful minutes before your body starts moving normally, the problem may not be age at all. Many people assume morning stiffness means their body is wearing out, but often the real reason starts much earlier, while you are asleep. You spend hours in one position every night, and if your body is not supported correctly, small amounts of pressure and tension build up hour after hour until you wake up sore, tight, and uncomfortable. The good news is that this can sometimes improve without expensive products, complicated routines, or changing your entire lifestyle. A few small adjustments in how you sleep can make a surprising difference. Think about this for a moment. You spend around a third of your life in bed. If your sleeping position quietly places stress on your neck, lower back, hips, or shoulders every night, that stress adds up. Many people focus on exercise, diet, and supplements, but completely ignore what happens during sleep. Yet your body is trying to recover during those hours. If recovery turns into strain, morning pain becomes part of your routine. One of the most common situations happens with side sleeping. A huge number of people naturally sleep on their side because it feels comfortable, but comfort at the beginning of the night does not always mean support throughout the night. Start with your neck. If your pillow is too high, your head tilts upward and your neck stays bent for hours. If your pillow is too flat, your head drops downward and stretches the muscles on the opposite side. Neither position allows the neck to rest naturally. Imagine standing during the day with your head tilted sideways for 6 or 7 hours. You would expect soreness, but people unknowingly do this every night. What you want instead is simple. Your head should stay in line with the rest of your spine, not angled upward, not sinking downward. Just neutral. When lying on your side, check whether your nose points straight ahead and whether your neck feels relaxed instead of stretched. Sometimes changing pillow height, not buying a fancy pillow, just adjusting support, is enough to reduce morning neck discomfort. But neck support is only the beginning. There is another area most people never think about: your waist. When lying on your side, your shoulders and hips create contact with the mattress, but the middle section of your body often lacks support. This leaves the lower back suspended slightly through the night. That unsupported area may seem insignificant, but over several hours it can create tension across the muscles surrounding the spine. The result? You wake up and feel tight through your lower back. You stand up slowly. Maybe you lean forward for the first few steps before your body loosens. A simple adjustment may help. Try placing a thin folded towel or small support under the space between your ribs and hips while side sleeping. The goal is not to force posture. It is simply to reduce that unsupported gap and allow the spine to stay more neutral. Many people are surprised that such a small change can feel noticeably different by morning. Now let's move slightly lower, your hips and knees. If your hip feels sore on the outside, if your lower back feels uneven, or if your knees feel stiff when getting out of bed, your leg position could be contributing. When sleeping on your side, the top leg often falls forward. That movement rotates the pelvis. Once the pelvis rotates, tension travels upward into the lower back. At the same time, your knees press together and place extra pressure through the joints. You may not notice it while sleeping. You notice it when you wake up. A simple solution is placing a pillow between your knees. This keeps both legs more aligned and reduces unnecessary twisting through the pelvis and lower spine. You do not need a special orthopedic product. A regular pillow often works. The idea is to keep the knees separated enough that your hips remain comfortable and your lower back stays relaxed. Small changes create better alignment. Better alignment often means less stiffness, and less stiffness means mornings become easier. For side sleepers, think of 3 checkpoints. Support your neck, support the waist area, support the knees. Those 3 adjustments alone can change how your body feels after a full night of sleep. Next comes another position many people choose because it feels relaxing: sleeping on your back. People often believe back sleeping automatically protects the spine. Sometimes it does. Sometimes it creates its own problems. If you sleep on your back and wake up feeling stiff through the center of your spine, if your lower back feels compressed, or if your shoulders ache before the day even starts, your sleeping setup may be working against you. Most people make one of two mistakes: too much pillow or too little. When the pillow is too thick, your head gets pushed forward. Your chin drops toward your chest and your neck stays flexed for hours. It may not seem dramatic, but imagine holding that position during the day. Your neck muscles would complain quickly. Now go the opposite direction. A pillow that is too flat lets the head fall backward. This places the neck in extension and can create tension around the upper spine and the base of the skull. Neither extreme helps your body rest. What usually feels best is somewhere in the middle. Your neck should feel supported while your face remains aimed naturally upward. One easy adjustment is adding support only where the neck curves, instead of raising the entire head. Some people place a small rolled towel inside the lower edge of the pillow, so the neck feels supported without forcing the head forward. Little details matter. Now let's talk about one of the biggest reasons people wake up with lower back discomfort: straight legs. That sounds strange at first, but stay with this. When lying flat on your back with both legs fully extended, the muscles at the front of the thighs can pull slightly on the pelvis. That pull may increase the arch in the lower back. For some people, especially those already dealing with tension or stiffness, maintaining that position for hours can leave the lower back feeling irritated by morning. There is a simple experiment. Place a pillow or rolled blanket under your knees. Not huge, just enough to create a small bend. This slight bend often allows the front of the hips and thighs to relax. As that tension eases, the lower back may settle into a more comfortable position. A lot of people try this once and immediately notice that lying on their back feels softer and less strained. Again, this is not about forcing posture. It is about removing unnecessary tension. Now let's move upward: your shoulders. Shoulder discomfort at night can be frustrating because even small pressure feels magnified after hours of staying still. People often do one of two things: they place the arm overhead, or they leave it pinned flat beside the body. Neither position feels great for everyone. Instead, allow the arm to rest in a supported position. A small pillow beside your body can support the arm slightly away from your side. That relaxed position may reduce pressure through the shoulder area. Think of sleeping as creating a comfortable environment for your joints, instead of asking them to hold positions all night. At this point, you might be thinking, "This sounds too simple," but simple adjustments are often the ones people overlook. The body responds to repeated patterns. Good patterns help. Poor patterns accumulate. Now here is a habit that can completely change the way you set up for sleep. Before turning off the light, do a quick body check. 3 seconds, that's all. Ask yourself, is my neck supported? Is my lower back relaxed? Are my hips and knees comfortable? That tiny routine trains you to stop ignoring discomfort before you fall asleep, because once sleep begins, your body stays in that setup for hours. Now let's talk specifically to people who feel pain on the outside of the hip. That deep, sore feeling near the side of the hip can become especially noticeable at night. One gentle technique some people find helpful before bed is using a tennis ball for light muscle pressure. Lie on a firm surface. Place the ball into the soft muscle area around the upper outer glute region, not directly onto bone. Slowly shift your body weight. When you find a sensitive area, pause. Stay there briefly and breathe normally. The goal is not pain. The goal is gentle release. Pressure should feel manageable. If it feels sharp, reduce intensity. Sometimes muscles that stay tense during the day continue carrying tension into the night. Helping them relax beforehand may improve comfort later. And there is one more simple habit that often gets ignored: a short evening movement routine. Before bed, many people go straight from movement to complete stillness. Your body spends the day sitting, standing, walking, bending, lifting, and carrying tension. Then, suddenly, you ask it to lie still for 7 or 8 hours. That transition is not always smooth. A short movement routine before bed can sometimes help reduce stiffness the next morning. One gentle option is this: lie on your back. Bring both knees toward your chest. Wrap your arms lightly around your legs. Then, slowly rock side to side. No forcing, no aggressive stretching, just gentle movement. 30 seconds to 1 minute is enough. The purpose is not flexibility. The purpose is relaxation. This small motion may help release some of the tension that accumulates around the lower back during the day. When muscles enter sleep in a more relaxed state, mornings often feel different. Consistency matters more than intensity. Do it nightly for a week and notice whether your mornings change. Now let's talk about something that surprises people: your dinner timing. A heavy meal close to bedtime can affect more than digestion. When your stomach is working hard while you lie down, certain sleep positions become less comfortable. Some people notice pressure through the abdomen. Others feel breathing becomes less relaxed. People who deal with occasional reflux or heartburn may notice symptoms more during the night. Try leaving a little space between your last large meal and bedtime. You do not need perfection. Just avoid finishing a heavy meal and immediately going to bed. Small changes stack together. And that leads to an important idea: do not change everything tonight. That is where people fail. They buy new pillows, new mattresses, new routines, then stop after 3 days. Instead, test one adjustment at a time. Tonight, maybe change knee support. Tomorrow, try neck support. Then evaluate. Your body will tell you what helps. Now, there is one sleeping position we have not discussed much: stomach sleeping. For some people, it feels impossible to give up. But if you regularly wake with neck stiffness or lower back tightness, this position deserves attention. Why? Because sleeping on the stomach naturally encourages rotation of the neck. Your head has to turn to one side to breathe. That means your neck stays twisted for long periods. At the same time, your lower back may sit in a more extended position. Again, not everyone experiences problems, but if you wake stiff every day, it is worth experimenting. You do not need to suddenly force yourself into a completely new position. Start gradually. Try side sleeping with support. Try back sleeping with knee elevation. Give your body time to adapt. The goal is progress, not perfection. And remember something important: morning stiffness is not automatically a sign that something serious is wrong. But if pain is severe, worsening, causing numbness, weakness, or waking you constantly through the night, it is worth discussing with a healthcare professional. For many people, though, the issue is simpler: hours of poor support, hours of unnecessary pressure, hours of positions that quietly irritate joints and muscles. Your sleep environment should help recovery, not create stress. So before bed tonight, remember this simple checklist. If you sleep on your side, make sure your head stays level. Support the space around your waist if needed. Place support between your knees. If you sleep on your back, keep your neck neutral. Support your knees slightly. Relax your shoulders. And for everyone, move gently before bed. Avoid sleeping immediately after a heavy meal. Take 10 seconds to check your position before turning out the lights. Most people do not realize how much influence sleep setup has until they finally change it. Then they wake up and notice something different. Getting out of bed feels easier. Standing upright happens faster. The neck turns more freely. The back feels less locked. The hips feel calmer. Not because of a miracle, not because of expensive equipment, just because the body finally had a chance to rest the way it was designed to. Tonight, pick one idea from this video and try it. Only one. Give it a few nights. Pay attention to how you feel in the morning. Small improvements repeated every day often become the biggest changes over time. And if you found this helpful and want more simple, practical health strategies that make everyday life easier, subscribe to Dr. Grace Longevity and stay with us for the next video.